You're watching ABC 17 News at 9 in high definition on Fox 22, KQFX.
Right now in mid-Missouri, 12 nursing homes have the lowest possible ranking given by the federal government. Some of the higher-rated homes are even guilty of major federal violations. Just last month, our cameras caught a search for a man who authorities say had gone missing from Riverview Nursing Care in Mocaine. He was found safe, but the incident got us asking what regulations are in place to protect loved ones and if the homes do enough to keep them safe. Since then, we have dug through dozens of reports detailing dangerous living conditions in nursing homes. In a special report tonight, ABC 17's Evan Millward shows us the worst among the nearly 70 facilities just in our area.
There are choices for those considering a nursing home for elderly family members. Skilled nursing facilities are regulated the most, but our research shows they're not all following procedure. In fact, dozens have been cited for abuse here in mid-Missouri. Some of the time, that abuse led to death. And the need to clean up these homes is becoming more important as the baby boomer generation gets older and the potential for problems grows.
Residents had broken bones, untreated bed sores, malnutrition, dehydration, infection outbreaks, medication errors, and abuse.
Nursing home nightmares are hidden in state documents year after year. And every year we bring you a story about abuses.
Nursing homes are getting a low grade from the federal government. At least
every year, same places, same problems.
Today shows more than 90% of Missouri.
So this year, we took it to the industry's chief lobbyist in Jefferson City and asked why the story isn't changing. Is there a crisis?
That doesn't exist. That facilities are clean, they're home-like, they're dignified, and there's wonderful life-affirming experiences coming from these great seniors every day.
But in the past year, 2 out of 5 nursing homes ranked below average in the state of Missouri. That's according to the federal government's Centers for Medicare and Medicaid. The ratings are based on 3 things: inspection reports, staffing, and resident satisfaction surveys. Those are 3 consistent categories both industry experts and advocacy groups value, although nearly half of Missouri homes aren't making the federal cut. We got a hold of a national nursing home advocate via Skype. Brian Lee from Families for Better Care calls these kinds of violations in nursing homes America's dirty little secrets.
They get poor care. They get neglected and abused, and it pretty much the system remains the same. It needs to be a wake-up call for Missouri.
3 companies own most of the nursing homes here in mid-Missouri. One that stood out to us was Jucket Management, based in Chillicothe. It stands out because the company has no website, no office address, and we've tried for a month to get the owner on the phone with no reply.
Can I take a message?
Jucket owns Ashley Manor Care in Boonville and Columbia Manor Care Center. Both have been cited in the past year for neglect, leading to preventable death. Here is a letter the state's Department of Health and Senior Services sent Hal Jucket, the company's owner, dated March 5th. The complaint says a resident at Columbia Manor Care Center suffered from diarrhea and dehydration for almost 2 weeks without the chief doctor knowing. At the request of the patient's family, nearly 2 weeks into that sickness, the resident was finally taken to the hospital, where the patient died. According to another letter of complaint, on July 11th, staff at Ashley Manor Care in Boonville broke a resident's neck on the way out of the dining room. The complaint showed staff didn't properly secure the resident in a wheelchair. That resident died 2 days later.
Do we not have a problem? No, as long as there's one tag written, we have a correction to write. But we do not have a crisis or a problem in Missouri at all.
The state corrects these mistakes with citations leading to fines. Over the past 3 years, Jucket Management has paid less than $20,000 in federal fines. We spoke to a consulting company who once worked with Jucket Management. Hal Jucket let that company go this year. When we ask who's now running the Jucket-owned homes, no one could give us a clear answer. Even those working in the industry say they can't get a hold of Hal Jucket. There's no telling whether the firm was fired over money concerns, but Missouri advocates say big business is often the big problem.
It is a big money-making business, but still,
Whether it's corporate or not, there are certain things that you should expect when you go there, and it has to be cared for, to be treated with respect and dignity.
If money's the source of the problem, we've asked if it could also be part of the solution.
I don't want to build another building at MU's campus until these seniors are taken care of.
But advocates are talking about a different kind of money, a different kind of solution.
If there's abuse happening or neglect, there should be steep fines that are levied against those facilities or steep sanctions. I'm just not seeing it.
In the past year, nearly a dozen bills were proposed in Missouri involving long-term care, but none of them would have imposed more regulation on the homes themselves.
We're completely changed from that old stereotype that people have given nursing homes.
Filing opens in just 15 days, and capital sources don't expect any kind of elder care bill this session. We asked the Missouri Healthcare Association if more regulations even needed.
I let the healthcare professionals tell me that. The medical director and the nurse in the facility and the care assessment of each individual need to be appropriate for the type of facility.
But if the industry requires change, now is the time. Baby boomers are already rushing toward retirement. And in the face of a $1 trillion federal deficit, we may not have the money to take care of them.
It seems like in society we go to great lengths to protect children, but we forget about people when they get elderly.
There aren't more 16-year-olds getting their first driver's license. There aren't more 21-year-olds thinking about going to their first happy hour. And there certainly aren't more babies being born than there are right now people turning 85.
Industry experts and advocates agree the best way to find a nursing home for your loved one is to do your research. But in this state, your research might not be easy. We've been working to get citations, complaints, and fine amounts from the State Department of Health and Senior Services. The department hasn't helped in our research for this story. Still, we got a hold of some of those complaints. We've posted them and other resources for you with this story on our website, abc17news.com.
And that was ABC 17's Evan Millward.